had a patient I write about in my book called, it's called Miss Mabel. So I guess it was a day or two after she'd been extubated, and I went to her room, and and she is starting to get a little bit more short of breath again. And I felt an urgency to understand what she wanted us to do. And I went into her room, and I started to talk to her, and I was trying to do advanced care planning, and what do you think? Would you like, would you want to be on this machine again, or would you not want to be? And she's leaning back in the bed away from me. And at that moment, Keturah, the social worker,
yes.
She was a social work intern. This was years ago. And all of a sudden, I noticed, she touches my arm. And she was right behind me. She said, Dr. Zitter, do you mind if I give it a try? And I said, thinking, what did I say? Was I okay? Was I racially inappropriate? Was I disrespectful? And she moves in front of me, and I step back. And she looks at her, and she says, she didn't touch her. She said, Miss Mabel, your hair looks beautiful. So, and Miss Mabel just relaxed, and all of a sudden they started to have this conversation. And then I could come back a few hours later with Keturah and talk to her. But I wouldn't have ever thought to call her Miss Mabel. And I would never have thought to talk to her about her hair. And that was really important.
You have to understand the dynamics that we're talking about here. It's about human beings not feeling respected and honored when they are in a very vulnerable position. And that's what we have to deal with. And if you deal with that, you're going to deal with the racism issue. You're going to deal with the judgmental issue. If we get to the point of seeing human beings who are scared, who are vulnerable, and who are dealing with all types of things in life, but then they come into a system where they're fearful, they have no control, they feel like they cannot speak for themselves and make decisions that are empowering. They don't feel like they have the autonomy. And so they're in a position where they're saying, I don't trust what's being said about my loved one, and I'm having a hard time.